Hello, everyone. My name is Marty Guthmiller, CEO at Orange City Area Health System, bringing you today the 84th edition of our COVID-19 community briefings and the first one of 2021. I'm also coming to you today with proof that there are other viruses out there besides COVID-19 because I have a cold. But it's a non-COVID cold. I know that. I've had COVID and I've tested positive for the antibodies. So there are other things out there. And as I mentioned, I am proof of that today. I do anticipate that these briefings will continue for a while yet, but will be weekly. So in the first or second day of every week, I will attempt to bring you an update. Unless anything, of course, merits more updates in the future. But at this point, we'll figure on weekly. Each week, then, we'll have a local scoreboard, just with what's going on locally. Again, we'll modify that depending on what's going on. So here we go. So our local scoreboard, we've done a total of 8,281 tests here in Orange City. 1,687 of those have been positive. That's a 20.4% rate. Again, probably not that important at this point. What's more important is that over the last 2 weeks, we've done 323 tests, 47 of those being positive. And so that's a rate of 14.5%, a much more relevant rate in terms of what's going on right now. Just as an example, the percentage we reported on December 21 with the week activity was a 25% positivity rate. And so for the last 2 weeks, to be at 14.5 is a pretty good number for us. Stepping back to Sioux County, then our 14-day average is 15.5%. That has not changed at all. It's remained unchanged over a week ago at 15.5. The 7-day average has jumped a little bit to 13.3. That was 10.8. Now, whether or not that's a result of the Christmas gatherings, we'll see. Currently, we're about 10 days out from Christmas, and we're gonna know this week whether or not there's any spike because of the gatherings that were held over Christmas. The positive per 100,000 population metric over the last 7 days is 237.8. That's 3.4% lower than it was on the previous 7 days. So again, that's a good thing. The 237.8 compares to the state number of 262.8. So actually, Sioux County is significantly better than the state average at this point, which we haven't been able to say for a long time. So that's good at 237.8. A reminder, and there'll be several of these, a reminder that we're not through this yet. We did have 93 individuals test positive in Sioux County over the last week. So again, nearly another 100 people tested positive this past week in Sioux County. Region 3, good news continues there relative to COVID hospitalizations at 83. That's down from 93, which was down from 106, which is down from 128, and then much higher previous to that. 13 people, though, of the 83 are in the ICU, and 6 of those people are on ventilators. So again, not through this yet. There are still really sick people out there, and but in terms of capacity and availability of beds, it's much better than it was, and certainly fine. Iowa, the state level, the last 14 days, individual positivity was 13.3%. That is up a little bit, 12.1 and 13.2 the last 2 times we spoke. Individual positivity for the last 7 days is 12.0%. That is up a little more from 9.4 and 10.4 previously. So a little bit of a bump in the last 7 days at the state level. Kind of wondering, is that Christmas related or not? And then I mentioned to you already that these individual positivity per 100,000 population number at the state level is 262.8, and that is up just slightly at 0.2% from the previous 7 day. So generally speaking, pretty good numbers all across the board so far. I just noticed I did not have the data for hospitalizations today for you. I will catch up on that next week, but I can tell you it's pretty quiet. As of today, we have 0 hospitalized COVID patients here at Orange City, and I would suspect the number across the state is pretty low as well. If you really want that number, go ahead and go to the coronavirus.iowa.gov website, and it'll be there for you. One more reminder that this is not over yet. We have had 3,992 deaths in the state of Iowa. That is 247 more than was reported on 12/28. I'm not clear as to whether that's 247 in the last week or simply how that was reported, but nonetheless, a significant number. People are still sick. People are still dying from this vaccine. The number in Sioux County is officially at 44 deaths, and so again, a reminder that this is not over, and we need to continue to be careful. The demographics really aren't changing, and if they are changing at all, it's really towards the older population more so. 59% of the deaths are 80 and over. Now 94% are in the 60 plus category. So if anything, that's creeped up from 92 to 93. It's at 94% now, but it is clearly still out there and clearly still affecting the most elderly and the most vulnerable significantly. As I mentioned, we have 0 hospitalized COVID patients currently at Orange City Area Health System. It's been relatively quiet COVID-wise, both in our walk-in clinics and our acute clinics and in the ER. So that is good news as well. On the vaccination front, big news. This week we expect to give nearly 200 vaccinations to our nursing home population and staff, as well as Landsmere Ridge Assisted Living residents and staff. This is through the Walgreens system, through the Pfizer, and we are at 97 to 98% of our residents have opted in to the vaccine, and so we're excited. This week is a big milestone for us. We're very, very happy being able to finally bring the vaccine there. And like I said, probably tomorrow there'll be just under 200 people vaccinated. Those are all scheduled up. The second dose is scheduled for January 26th. That will also be the first dose for those people that either weren't around on January 5 or have decided since January 5 to get the vaccine, and maybe that would be mostly staff. But again, January 26th is the follow-up for the people that receive it on January 5, tomorrow, and then the first dose for those who opted not to get it this time. And then the second dose for those people will be on February 16. So by February 16, we should have everybody vaccinated that wants it in our senior care population. And again, that includes staff. Here at the hospital, we are through the Moderna system, through the dosages or doses that have been given to us from the state. We have received approximately 400 of those. We've been able to get more than just 10 out of each vial, sometimes 11, sometimes 12. So it'd be a little over 400, but we received 400 vials. About half of that is currently has been given or is scheduled to be given this week. We are still in phase 1A of the definition of eligible people for the vaccine. 1B is next. 1B includes firefighters, law enforcement, teachers, food workers, agricultural workers, those kinds of things. So the list expands quite a bit on 1B, but we don't know when 1B will be authorized by the state. So currently it's 1A, which continues to be healthcare personnel, paid or unpaid, direct or indirect exposure. And we are complying with that and administering the vaccine in accordance with those standards. Again, we're encouraging people when eligible and when called upon to get their vaccine, we'll continue to try to get that information out as soon as we can. I feel like I'm on the verge of coughing with the non-coronavirus virus. So I'm going to wrap up today, and I'm just going to remind people to stay strong, stay vigilant, and above all else, stay healthy. The fight isn't over, but we're just about through it. Happy New Year to all of you, and again, look for a briefing early next week. Thanks again.